I know everybody's life has dramatically changed, and certainly as a fertility practice, my practice has dramatically changed. COVID-19 has impacted fertility treatments. In fact, on March 17th, the American Society of Reproductive Medicine kind of recommended or had guidelines that everybody, stop all fertility services. In fact, about 80% of practices did. Some practices remained open as long as they could, based on kind of their opinion of the medical guidance. And April 24th, there was another guideline said that we could support reopening fertility practices. And as of May 1st, most fertility practices are resuming treatments, although those treatments are the way our practices work is significantly different, and we'll talk about that a little bit more as we proceed. So basically what's most important to us as we move forward is the patient's safety, as well as the staff itself at the fertility clinic. We need to protect them, and obviously we're concerned about the health and well-being of the pregnancy to come. So we have a lot of people to keep safe as we move forward with this. So we're always looking to follow both CDC, federal and state guidelines, and some things actually have been out of our control. But I think you need to, whatever clinic you're working with, you need to make sure you're talking with them, asking the right questions, and make sure you feel like those questions have answered. Coronaviruses have been actually part of our human pathogen mix probably for as long as humanity. There's two other coronaviruses that we know about, SARS and MERS. They're both coronaviruses that were associated with pretty severe illnesses, but they kind of burned themselves out. They did not have an association with infertility or fertility. And at this point in time, there's no studies on COVID-19 and effects on fertility. In fact, the American College of OBGYN, which is the professional society that's kind of responsible for all things pregnancy, has not come out and said that opposite sex partner couples should avoid pregnancy, and has not come out and said there's any increased risk of COVID-19 in pregnancy. Right now, there's no evidence that the virus can be transmitted through reproductive tissues in the IVF laboratory. You guys may have seen popped over CNN that the virus seems to have been found in some semen samples in people who were acutely infected with COVID-19. But there are other studies that say people who are no longer acute, the virus is no longer in semen. As far as in the IVF laboratory, as a point of reassurance for you all, there's actually no evidence that any virus in the context of the IVF laboratory where we have a single egg and a single sperm transmits any virus. And that may be that reproductive tissues are in a very privileged place in everybody's body, and therefore don't get infected by viruses. In regards to moving forward during pregnancy, so what do we know? We know that over 150 children have now been born to women that were infected with COVID-19, and those babies who were born via C-section have tested negative. So we do not believe the virus can make it through a third trimester placenta. We don't have any data on viral infection in the first and second trimester affecting the fetus. We have limited information coming out of China and South Korea. I assume there'll be more as the year moves forward, but the hope is that as with other coronaviruses, that if the woman carrying the child does not get very ill, the pregnancy should be protected and move forward. The other kind of piece of encouraging news is that it doesn't seem that pregnant women are preferentially more ill than other women who are infected with COVID-19. We are responsible to educate patients on COVID-19. Obviously, there's a lot of information and misinformation and disinformation out there. I think it's important to understand that the virus is transmitted through droplet spread. It's It's not transmitted via a lightning bolt. But you have to be exposed to the virus via droplet spread. Every practice is instituting pre-screening questions, entry monitoring, including masks, hand washing, and temperature checks. We ask every patient about potential exposure, and we have this big, beautiful waiting room that's now empty because we don't let people wait in the waiting room. And in fact, our patients all have appointments now, and we call them up from their car when they get here. On another note, we used to allow everybody in the waiting room. We used to allow partners in for embryo transfers and things like that. But at this point in time, back to the operating room suite, it's just the patients. And in the waiting rooms and into the office, it's just the patients. It's already started as a virtual appointment. But we're going to have typically dads-to-be would be asked to produce sperm specimens, perhaps in collection rooms. They'd come in for blood testing for recessive carrier screening. And some of the things that are going to change is I think that people are going to produce sperm off-site and bring it in because we don't want the potential, the collection room to be a source for you to get infected. Saliva tests are going to be used more frequently for screening for recessive carrier, recessive genes that can cause disease in children. The other thing is home saliva kits, I hope, and it seems to be validated, are going to come online maybe within the month, and as far as testing for COVID-19. So intended fathers might be asked to test for the presence of the virus prior to producing a sample. We don't know how this is going to settle out. Kristen can talk a little bit more about gestational carriers, but there's a concern that there may be reduced availability as people are home taking care of their children, or not working, or not able to travel, or not willing to travel across the country to be an egg donor or to be a gestational carrier. And many of the IVF practices that we typically do monitoring at, if they're not local to my office, are going to have limited patient appointments. So all these things are going to affect the way these cycles work. To be a dad through egg donation and surrogacy, it kind of involves the fertility clinic, an egg donor, a surrogate, a surrogacy agency, a legal team, and there's a lot of travel and coordination that goes on with that, and that's certainly all affected by COVID-19.
Obviously, there has been a lot of change in our lives for COVID-19, but generally the process of the surrogacy agency has been largely uninterrupted. Now, that doesn't mean the surrogacy process has been largely interrupted, but for the most part, as you come in to meet with Simple Surrogacy, for the most part, you're doing that first by phone and by video. So that part of the process hasn't changed. You would fill out a form on our website and do a consultation, and everything is done virtually. So we continue to still do it in that manner. Very few people actually come into our offices to meet with us to get things started. I think that's the case with most agencies. In some cases, we don't actually meet with our clients until they go to the clinic. And in some cases, if they're international, even until they have a baby. So that part of the process has not changed. There are some small changes in that all of our staff is also working from home and homeschooling their children at the same time. So there is a little bit of juggling, but we've got a good system in place to prioritize those clients that are actively cycling, that need more hand-holding. And I think a lot of agencies have, conformed to that working way due to the COVID-19. The surrogacy journey is about the same amount of time. So it's still taking around 15 to 20 months of time. In some cases slightly longer. And we do see, as Mark said, that there are going to be greater timelines involved. And that means that, yes, there may be fewer cycles done at a clinic in a month. So you're not going to be able to maybe get in the exact month that you finish your legal. There may be a little bit of a delay if there needs to be a COVID test done before someone can travel. There may be fewer cycles available. There may be fewer surrogates available because they are at home homeschooling their children and, probably trying to juggle their work from home job if they still have a job. So of course, we're still taking precautions. All of our staff is working from home. We don't have anybody currently in the office. We are not doing in-person consults at this time just to eliminate the contact for our staff. But we're still doing continuously Zoom meetings and webinars like this where we can introduce our agency and kind of walk people through the process. And really a lot of what we're doing at this time is helping people prepare. So if you're at a point in your journey where you think you want to have a family, but you're not really sure how to get started, this is a really good time to kind of break the process down and work through your budget, work through your clinic choices, work through your ideal needs for a surrogate and for an egg donor, and really start to just get into the process and shop around. Shop around for egg donors, shop around for agencies and clinics, and really gather all your information. And that's the point of view that we're taking at this time, is that, everyone is looking forward to having a family. This COVID-19 crisis is not going to be as intense as it is currently. It's going to let up. And when that happens, if you prepare now, you can be really well positioned to start things, ramp up and begin the process really in earnest once we're all out of lockdown. So what we're trying to do at this point is, if you are ready to move forward, again, that's a very personal decision, but if you've got everything lined up and this is the time for you to start, it is a good time to get started with the matching process, because as surrogates are coming in and as clinics are starting to open back up, you can already be a few steps down the road to your matching and have everything lined up for when the clinics open. So that's actually a really good position. We do have a few people who are taking advantage of that somewhat slower time to have a little bit more attention paid to their cases and a little bit more work done up front before they get in for screening. And so obviously it's a really personal decision whether you want to get started. It's a good idea to start the matching process if you're in a financially good, solid position right now and you're ready. If you're not ready, then it's a good time to plan for the future. I think one of the things that myself personally and a lot of people I've spoken to have realized throughout this crisis is that it really boils down to what things you find important. And if you're on this webinar, most likely you're noticing that maybe family is really important to you. And being home with my kids, while both a lot to do, it's also really amazing and really rewarding. And so if parenthood is something that you have already thought about, I think this crisis in a way really brings it to the forefront of how important that is to you and how important it is to all of us to have our families close in times like this. So if that's something that really appeals to you, if that's a route that you would be looking for, this is a really good time to get started. And I don't think the COVID crisis should deter you. In fact, if anything, it should really make you realize how important it is to get those things going. And so, yes, it's going to be a new normal. Things are going to change. But as I said, I don't think they're necessarily all for the worse. We're seeing a lot of good positive changes in terms of contracts. We're actually seeing, just this week, we saw Italy revised, and I know this doesn't apply to everyone here, but Italy revised their process for getting citizenship for a surrogate baby to make it a mail-in form instead of having to go appear in court. And so in a lot of cases, we're seeing things that are going to be a little bit easier for people to do, that are going to be a little bit more streamlined. And in some cases, we are seeing there's going to be a little bit more precautions taking, a little bit more slowing down, a little bit more prep before we get to the cycles and things like that. So surrogacy is going to continue. I think it's really, as I said before, really brought it to people's minds of what's important. And I'm really grateful I have my kids, and I'm really grateful that I get to help other people realize that dream as well. So if someone does not have a partner, I think it is still a good time to get started. We see a lot of single intended parents come into the program, and I don't see a huge difference really in matching a single intended parent versus a couple. I would still agree that it's really a good time for a single intended parent to get started in the process.
I typically kind of bucket out costs into two buckets. It's the fertility clinic cost and the surrogacy agency cost. So our fertility clinic costs for embryo creation kind of depend on where your egg donor comes from, whether it comes from my clinic or outside, whether you pursue embryo testing. And the fertility clinic cost for embryo creation plus 2 transfers or perhaps unlimited transfers kind of comes up somewhere between $40,000 to $50,000. And then the surrogacy agency costs range. I can let Kristen certainly talk about that. I don't see there's any, COVID-19 is not going to increase costs, certainly. In fact, because we've had this time, we redid some of our cost sheets and we made things a little bit lower just to make it a round number and nicer. So I've been doing that over the past week. So I don't think there's any appreciable change in costs on the IVF clinic side to be expected.
I agree. We are seeing a few additional costs, but it's really mostly for people that are in the process that got stuck in the process before they could move forward. Things like if you were already paying a surrogate's insurance policy, you can't just stop paying the insurance policy, even if there's not activity happening on their case. So hopefully in most cases, we're seeing things get started back up again. So that's only a month or two that we've seen of additional costs. And as I said, we're trying to be really proactive moving forward in terms of the monthly allowances and things that are in future contracts. The other costs we are seeing increased are generally for international IPs. If someone came in early to avoid the 14-day quarantine period, then they're now stuck here. So we've had some IPs that have been stuck in the country for 8 to 12 weeks is now the average time to get a passport. However, if you're just getting started in the process right now, those things are really not going to apply to you. We're going to have all of that figured out, and the country is going to be open back up again. We're already open back up again in Texas, where we are. So we're already really processing people through. So for the most part, someone who's already not in the process isn't going to be affected by increased costs. I think from our point of view, not necessarily. And I'm sure Mark will speak more to the medical side of it, but right now, all the teachers are home, so they're not exposed to anything. So while that could be potentially a frontline thing, I don't think it really applies now that all the teachers are home. So teachers are probably pretty safe. And if they go back to school, they're really just going to be exposed to kids. And from what I've seen on the news, again, not a medical doctor, I'm not seeing that kids are really carrying and spreading this virus. At least they haven't been shown to in the other countries that have experienced more infections than we have. As far as frontline for nurses and those kinds of things, I think it could possibly be a concern, but the research so far has shown that there is not an effect on pregnancy. So I don't think we should necessarily rule out a good candidate just because she could potentially have an exposure. The other thing I would think too is that if there is shown to be any kind of relationship to pregnancy having issues, that as soon as someone was, confirmed pregnant, that they would no longer be allowed to work in the hospital or whatever that they worked for, would have to relocate them to a different area.
As far as it's hard to find a surrogacy relationship is based on trust. And I think that the surrogates want to stay healthy and well. They want to protect their own families and your baby. So, I think you should, any surrogate that's presented to you, you need to look at her whole picture and not exclude them simply because of what their chosen vocation is. I think it's a very special relationship, and you should just look at everybody that's available. I think right now we're still in this phase that if you're going to go visit your surrogate, you've traveled to her. You don't want her to get infected. So I think you're going to be wearing a mask, and she's going to be wearing a mask, and you're going to maintain your 6 feet of distance. I think that's the only reasonable safety-based decision at this point in time. Is that going to change in the future? It may, but I think that unfortunately, the time of hanging out and sharing food and doing those things is far off. So I think visiting your surrogate, yes, but that visit's going to be a little bit different.